सर ये ना इसमें ये आ जाएगा.
Thank you very much for the nice introduction. I'm very lucky that Professor Dr. Naseem, we were sitting in the desks like you some 40 years ago, and he is leading this university, and we were smelling at that time that the time will come that he will be the leader of this great institution. Not only the professor here, Dr. Athar, but a good motivational speaker whenever he uploads something on some topic, I very keenly follow it, and I think we are very lucky that head of poultry department is of that caliber, who is very much associated with the poultry industry. Thank you, Dr. Sir. And thanks to Dr. Athar, Dr. Jadoon, and other friends. We have been listening, 30 minutes? So in 30 minutes, we have been listening that we have to reduce the antibiotics. Now before, we imagined that why we were using antibiotics, it was kind of history. Started with human beings and then came to the animals. But when you look at the animals, particularly poultry of that time and the poultry of today, there are many, many things which made the bird comfortable, and if we follow that, then definitely we can grow them without antibiotics. And it has happened in several countries, and it will happen in our country as well. So, why the bird gets sick, first of all? Is he getting not proper management of temperature, humidity, ventilation? Is he carrying some kind of infection before it came to the farm? Is it not eating proper feed? Or its immune system is compromised? So now we are able, with the help of the scientists, to know that why the birds get sick. So, there was a seminar I followed very recently, and it was exactly matching with the topic which I am going to present here. It was by Wart Publications. And then in Holland, Dr. Janine, as you can see, she is a vet, and she is the one who serves the farm and very actively pursuing the use of antibiotics in poultry. And what to do that the bird immune system should remain good is this man who has done a lot of work. So it's a combination that why the bird gets sick, and before we have to see the factors before that. But just a bird eye view, how antibiotics work. Well, first of all, if there is a bacteria which is causing the problem like colibacillosis, salmonellosis, or other bacteria, so some of the antibiotics, they are inhibiting the cell wall synthesis. So when the cell wall will be inhibited, the bacteria will die. Inhibition of protein synthesis, if the food supply will not be there for the bacteria. Inhibition of nucleic acid synthesis or functioning. So nucleic acid is the brain type or the driving force, and inhibition of total folate synthesis, and then damage to cell membrane functioning. So all this we achieve with different antibiotics. Now, reduce impact of bacterial infection, treatment and prophylaxis, growth promotion, making poultry meat safe from zoonotic infectious agents, and achieve best clinical outcome, and slowing emergence of resistance. So these are the the goals for which we were using, or we are using, antibiotics. Now looking at treat or not to treat. I mean, if you saw the condition like this, that does the condition necessitate antibiotic treatment? So now it's not just random that you put antibiotic, but it's important that we see if it is necessary. Are there other options beside antibiotic treatment? So we have to look other options. Will potential consequences outweigh benefits of antibiotic treatments? So all these categories we have to study before using the antibiotics. Now, general principles. Spare important antibiotics for human health. As Professor Dr. Naseem said, that the priority are human beings, not the food animals. So we have to keep our antibiotics safe for our human lives. Use only at reasonable risk. Prefer culture and sensitivity. Use narrow spectrum. So you see, whenever you have to use, you have to consider like this. Use for short duration, not for long duration. Consider all factors like bioavailability. Maybe you are using antibiotic, bacteria is somewhere in the respiratory system. You are giving medicine through GIT, oral route, and the bioavailability of the antibiotic will not be there. Avoid off-label use. So don't use any medicine like we are seeing now, this kind of practice. Educate farmer to comply. Use antibiotic with mutual trust, vet and farmer. So this is already implemented in some of the European countries, particularly Holland. Now, do not replace management practices with antibiotics. Here is this point I want to highlight. Since my graduation, I am in poultry industry, whether it is local or international, and I have been working for a long time in one of the big poultry companies in Middle East, and I have learned that if we manage the birds properly, which we are not managing, then definitely we are going to reduce the need of the antibiotics. Reduce all causes making bird susceptible to infection, and follow human values. Again, the emphasis is that we have to follow the human values. Now, if we look at why this is infection, we treat, and the treatment is to the humans, and this bacteria goes back to the humans. This is one-way traffic. And if we give to animals, and animals are consumed by the humans, and then finally the resistant development is there in the human beings. So this cycle is two-way, and this is very much important relevance of antibiotic use and antibiotic resistance. Now, future projections, if you can see impact of antimicrobial resistance, and you can see here that 10 million people can be threatening to their lives, and none other diseases, even cancer, is close to that. So it's a very well topic taken by UVAS today, and because in future it's going to be a big threat, bigger than any other disease, if you can see what are other diseases and what will be the effect of antimicrobial resistance. Now, if you see here, this is the milligram of antibiotic used per kilogram of the animal produced. So if you go from lighter color and go towards the more darker color, you will see some of the countries are using a lot of antibiotic milligrams per kilogram of animal produced. So we are here in Pakistan, this is Pakistan, and we are somewhere, I say 50 milligrams. So even that one is something which is concerned. Now, before we came to this room, Professor Naseem was talking about the use of antibiotic, and he was mentioning Europe and other developed countries. So you can see EMA report on the use of 2016 in milligram active ingredient for per kg of animal biomass. So you see here there are different European countries. For example, this one on top is Cyprus, using very high amount of antibiotic, above 400 milligrams. The average of all these countries are somewhere here. But there are countries like Norway and Iceland, for example, although they have little poultry, but they are using very, very little antibiotics. So it's not something that we have imagined, but it is something which we can see practically happening. Now, this is another proof of, if you look at this full spectrum antibiotic is in red color, reduced use, ionophores mostly used for coccidiosis, and no antibiotic use. So you see here that now that we are in 2019, this is the data. So no antibiotic use bar has got very long. While if you see a couple of years back, it was the shortest bar. So you see here that from 2015 and then 16, then 17, 18, 19, the no antibiotic bar has increased a lot. So this means some of the other improvements has been done. Again, educate and set benchmarks. So today conference, today seminar or summit, I think we will set ourselves some benchmarks. Choosing antibiotic and early warning of resistance. documentation, time and reason of treatment, causative agent. So this could be the start of reducing antibiotic use, which is still looking an uphill task, but I think before the regulation will stop us, we have to see that what are the early warnings, and we have to document when we are giving treatment. Now look at here the Netherlands example, Holland example. You see here that different species of animals. You can see purple is the turkey, is using quite a high amount of antibiotics. Blue is veal cough, orange is broilers. So you see broilers, it was too high in the past and now it has dropped like this. And light green is the animal which we don't like, of course, here. And dark green is the dairy cows. This is, so you see the poultry is still behind compared to dairy cows, but poultry is doing quite reasonable progress compared to other animals. When we look at farm level use of antibiotics in broilers, so you see in the past it was such a high use, and gradually with the strategies applied, you can see is reducing, and now when we are in 2019 and 20, it's negligible, it's so low. So this is a living example that we can reduce antibiotic as much as these people have done. So look at here, 80% of Dutch broiler flocks, no antibiotic treatment. So you see this green bar, it shows the broilers has been grown with no antibiotic. So it's not a dream, it's some people, and Netherlands, you know very well, is the country which is very, very good in livestock and particularly in poultry. Now, looking at different antibiotics, so you see here different antibiotics, and all of them, the use is coming down. Whether you look amoxicillin, whether you look tetracyclines, ciprofloxacins and others, it is coming down with the time. So the milestone or the objective we are going to set today is basically achievable, provided we work towards that. Now, antimicrobial resistance in pathogenic E. coli from broilers. So you see here the green bar is increasing, so the resistance is reducing. Future challenges, the future challenges, and I will call it, the slogan for today is precision farming. Instead of saying reduce antibiotic, people get frightened, our birds will die. So the slogan could be, and it is already in practice, is the precision farming. So precision farming, which means good farming management. You cannot cure the birds if the management is bad, biosecurity is not good, and vaccination is not proper. And of course, the housing where we keep the birds. When the environment control houses were in progress in construction, many people said to me, "Oh, तुसी डॉक्टर ते बहुत ऊंचियां गल्लां करदे हो, ए देखो फलाने ने ना profit कमा लिया." So, science cannot be wrong, because they were not in comfortable situation, the birds, and those farmers unfortunately disappeared. So early detection of abnormality and disease monitoring. So the primary diseases mostly is not bacteria, because because antibiotics are used for bacteria. The primary diseases are viral, and the viral diseases are cured or prevented by vaccination. And the vaccination depends upon the immune system of the bird. And then treatments and alternatives are available, which my colleagues may be talking about. So early and adequate diagnosis, you can see these points: selection of bird, sampling tissues, sample materials, sample transport to the lab, test method, culture, etc., diagnosis, bacterial disease, start before symptoms, and confusing in low bacterial load, early diagnosis, effective treatment. So these are some other sportive points. While we are monitoring disease, we have to think of safe and effective control, cost-efficient production, sustainable production, monitor effect of control measures, track disease, pressure, and early warning and early response. So, this is something very interesting in front of you. And you see this bird, this very same bird, it has temperature on its body and then on its feathers, around it, and in the surrounding. So it is very, very important. It is very, very important that the temperature where the bird exchanges the heat normally is the breast muscles where the bird is exchanging heat. So if the temperature there is cool, and wherever I practice, I am comfortable keeping it at 28 to 30 degrees centigrade, whether it is a small chick or a bigger bird. There the bird remains comfortable in the comfortable temperature zone. When the birds are lame, for example, this means they are sitting, and this temperature monitor, it can tell you that how many birds are lame in this house by monitoring the temperature, because while sitting on the ground, the bird will be. So this is one of the very important message to get the antibiotic-free world in our poultry. It is important that the bird should remain comfortable as far as the temperature is concerned. If the bird temperature is higher, and it's not now the temperature of the thermometer, it's not the temperature of the house, doesn't matter, it's the temperature which birds get on the breast, and if that is correct all the time, then your bird is comfortable. This is kind of monitoring of a bird in a certain area, and that tool also tells us that how much bird is towards feeding and watering, so that as I mentioned earlier, that if the temperature of the bird is okay, if the bird feed and water approach is okay, this means it is doing well. Now, kitna time reh gaya? 5. So I have 5 minutes. So precise feeding and watering. So precise means what should be the height of the nipple drinker, what should be the height of the feeders, along with the age of the birds. Because bird cannot drink like a camel, for example. Bird drink like the birds drink. So the nipple height should be 90 angle from the beak and the tip of the nipple and to its toes. It should be 90 angle. Note and act with the deviations. If there are deviations, correct them. In presence of pathogens, in absence of pathogens, or risk assessment. See here, there is a normal pattern of the birds and improving production, economic returns is to keep the birds in the same uniformity if it is layers or breeders and on the target body weight. So the belly of the weight should look like this. So when the birds are in proper weight, proper uniformity, and they are layers and breeders, they lay well. Here, individual variation and predictive values. So you can see here, these variations of water consumption also tells you that there is something wrong with the birds. So if nobody checks that, this means the bird will get sick and you will try to treat with antibiotics. Prediction and practice, monitoring, time of vaccination, and combination of vaccines. So, towards concluding, the major problem comes from the virus, and the vaccines help when the immune system is good. So you see here that less antibiotics are possible, that when you want to keep your birds healthy, and that focuses on the management. And also less antibiotics are important for this well-being of the bird. And here, I want to talk about the immunosuppressions. So here you see it is crossing here and there different factors by which the bird's immune system is compromised. The bird is born by immune system bursa and thymus. So when the immune system is compromised, then the bird cannot sustain. And if the bursa size has reduced, then of course, as you can see, the normal bursa histologically is like this, and when there is a damage, it goes like this. So if the bursa is compromised, you cannot. And sometimes the Marek tumor infiltration in the broilers do come also. Mostly it's adult bird disease, but some of the immunosuppression is caused by Marek's as well. So there are tools available now that you can really overcome the immunosuppression. You can see here consequences of immunosuppression, and you can see here early immunity. So when you get early immunity against certain diseases, and that's why more and more hatchery vaccinations are coming up, which are more accurate compared to the farm vaccinations, then the bird get early immunity, and due to that, it is you need very, very little antibiotics, and you get good production figures. Hatchery vaccination, as I mentioned earlier, so it is done for Marek's and Gumboro together, and it can be done in eggs as well, which we call ovo vaccination. And here you can see the cell-mediated immunity is more when the birds are vaccinated early. Also, the cell-mediated immunity stimulation is more when the birds are vaccinated early. And protection of the immune function of the chicken, it is very well protected. So as I said in the beginning, when the immune system is protected, your viral vaccines will work better, your bird will get good immunity, it will not get sick because you have kept a good management, good body temperature, good feed and water supply. And take-home message is what I mentioned already. So it is the management, it's the early vaccination for immune system as well, and with that you will really overcome to the target of reducing antibiotics. Thank you very much.
If you have any question regarding this presentation, you can ask.
वालेकुम सलाम।
ये है कि हम हर चीज पे बर्ड को ब्लेम करते हैं कि बर्ड से डिजीज आ रही है, मतलब बर्ड का एंटीबायोटिक दे रहे हैं। अगर हम ह्यूमन की प्रेफर करें, हम डॉक्टर के पास जाते हैं, डॉक्टर कहते हैं एंटीबायोटिक है, फीवर है एंटीबायोटिक है, एनी टाइप ऑफ डिजीज एंटीबायोटिक है। तो हम फिर ह्यूमन को देखें, उसमें ह्यूमन को एंटीबायोटिक ज़्यादा लेके बर्ड डिजीज टाइप से आ रही है, ऐसे पेट में बर्ड को कैसे करेंगे, बर्ड को हम ले रहे हैं, बर्ड से एंटीबायोटिक आ रही है, मतलब टाइप है इस पे आप कैसे आंसर देंगे?
ये इस क्या क्वेश्चन, आपके क्वेश्चन की समझ नहीं आई। आप ये माइक इधर आके क्वेश्चन कर लें या कुछ करीब आ जाए, आप करीब आ जाएं प्लीज।
आगे आगे
इधर आ
स्टेज पे आ जाओ, स्टेज पे बाकी लोग इसमें बेटा बोल दो कुछ, इसमें बोल, इसमें ये बोलो।
सर मेरा क्वेश्चन ये है कि हम लोग ना हर बात पे बर्ड को कहते हैं कि मीन्स बर्ड हम ले रहे हैं, उससे हमें एंटीबायोटिक हम उसको दे रहे हैं, तो हमारे अंदर डिजीज़ आ रही हैं बर्ड से। अगर हम ह्यूमन को देखें तो हम डॉक्टर के पास जाते हैं, कोई भी एनी टाइप ऑफ फीवर है हम लोगों को, वो डॉक्टर कहता है कि एंटीबायोटिक लें, मॉक्सिल लें, एनी टाइप ऑफ कोई भी डिजीज़ है, हमें डॉक्टर कहता है एंटीबायोटिक लें। तो अगर हम जो वो एंटीबायोटिक्स यूज़ कर रहे हैं, उससे हमारे अंदर टाइप ऑफ डिजीज़ नहीं आएंगे कि अगर हम कहते हैं कि ये हमने बर्ड खाया तो हमारे अंदर बर्ड से ही डिजीज़ आ रही है एंटीबायोटिक की। तो अगर हम ह्यूमन को देखें तो हमें डॉक्टर तो नंबर ऑफ टाइप्स की एंटीबायोटिक्स प्रिस्क्राइब करता है, उस पर आप क्या आंसर देंगे?
चले बैठे, बहुत अच्छा सवाल है, और भी कोई सवाल हैं तो ज़रूर बताइएगा। इनका सवाल है कि एनिमल्स को हम एंटीबायोटिक देते हैं तो रेजिस्टेंस आती है, एंड इफ़ वी गिव एंड वी आर गिविंग अ लॉट ऑफ एंटीबायोटिक्स टू ह्यूमन बीइंग्स, well, we are actually saving antibiotic for human beings. And as you saw in a slide here, it's this slide, it's a two-way resistance coming. It's not just that only animal edible things are giving us resistant bacteria. Rather, it is resistance coming from human beings also. But there we have no choice. We have committed to the human beings that we will not be the culprits providing you the resistant bacteria or the resistant antibiotics to the human bacteria. So that's our promise to the human beings. But what's going on there, it's they are also thinking about, but we have seen that stopping antibiotics in poultry, and it has happened in several countries, it works, and we are not blamed now that we are giving resistant bacteria. Is that clear? इधर आ जाए।
माइक ऑन कर दो।
कौन है बोले?
So my question is, how is antibiotics to be bacteria? So as you have told that in 2018 that the ratio of antibiotics for the adults.
बेटे इधर ही आ जाओ, अपनी
मास्क थोड़ा उतार के बोले ना, क्लियर आ
नहीं,
गई।
मुझे आवाज़ नहीं आ रही।
मास्क की वजह से ना वो वहाँ आ गया।
सर मास्क बस आपकी क्वेश्चन होगी। अब बच्चे इधर आगे बढ़ो। अभी साहब